started.
Hello, good evening, everyone. Thank you so much for joining us today. My name is Rosabelle Wu, and I am currently the president of UNSO. Today, we are so very excited to be partnering with NYU Myers Recent Alumni Council to be hosting this program this evening. So the council encourages you to stay connected with the school by attending alumni events and volunteering. There are many benefits to being an NYU alum, including the fact that you can keep your NYU email for life. And you will also have access to many benefits and services exclusive to only NYU alumni. So for more information, check out the alumni tab on the NYU website. So for this event, as nursing students, we all know that we have many burning questions about what it's like as our first year as a nurse. And this event essentially bridges the gap between what it is like being a student to what it is like to be an RN. And with the COVID-19 pandemic, this has added another layer of complexity to this profession, especially since we're going to be joining in the next few months or few years. There have been many changes, so it is really important that we stay up to date about what the most current workforce looks like to us right now. So today, we have alumni here to speak with you about their careers and what to expect after graduation. So I will now take a moment to introduce our panelists. Our first panelist is Joseph Curto. He graduated with his master's degree in 2017, and he used to be a formal travel nurse. He is currently a nurse practitioner at Mount Sinai and covers 3 units: the medical ICU, cardiac ICU, and the rapid response team. Next, we have Zach Dolkert. He graduated with his master's in 2021 and his bachelor's in 2016. He is a pain management and orthopedic acute care NP at NYU Langone Orthopedic Hospital, and he formerly worked at Hospital of Special Surgery. Lindsay Garcia graduated in 2013 with her master's degree, and she is currently the director of nursing for neonatal services at Yale New Haven Health System. Next, we have Edwin Kim, who graduated in 2016 and works in the emergency department, observation and medical surgical units at NYU Langone Health. Adam Haydes graduated in 2017 with his bachelor's degree, and he is currently in the NYU NP program to become an FNP. He currently works in the emergency department at NYU Langone Health. He previously also worked in the ICU, and he will be graduating this May. Julie Lipton. She graduated with her bachelor's degree in 2015 and currently works in the labor delivery unit at NYU Langone. Tiffany Minto, she graduated in 2019 from NYU, and she's currently a psychiatric RN at Gracie Square Hospital. She is currently in the Psych Mental Health NP program. And lastly, we have Marianne Peterson, who graduated in 2014. She is currently a neonatal and pediatric critical care transport team at Cohen Children's Medical Center. So as you can see, all these great alumni have joined us tonight, and they have all graduated, just like how we are currently in the program. They were also in the program at one point, so they understand what it is like to transfer from being a student at Myers to being a current working nurse. So if you have any questions at all during the panel, please type them into the chat, and we will get to them as many of them at the very end of the panel, and we will have a discussion. So for now, please mute yourselves during the presentation, and when the panel concludes, what is really cool about this event is that there will actually be breakout rooms set up where the panelists will each have their own breakout room, and you as an attendee will be able to choose which breakout room to enter in to network with them. So without further ado, we're going to get started on our panel now. So our first question, we'll go to Lindsay. What were some of your biggest challenges transitioning from school to being a nurse? And if anyone wants to add, you can add that too.
Great. So welcome everybody, and congratulations on being in nursing school. You're gonna start a phenomenal career when you graduate. So my first job was in a neonatal ICU. I was very fortunate. I knew that's the specialty I wanted, and I went straight there. But it was hard because some of the hard things were finding that balance of wanting to learn everything so quickly and wanting to show and prove myself, but also in a specialty like neonatal ICU, the details are so important. So finding that line of moving really fast to show that I am supposed to be here and that I can be here, but also not forgetting about the details. It was, and another hard part was I went straight to night shift, which most new hires do. And then the resources on nights, they are there, but it's hard to necessarily point them out in the beginning and learning what my resources are, who to go to. I definitely fell into the trap of going to my peers who started maybe a month before me because I felt more comfortable going to them rather than going to my nurses who really know what it's like to be a NICU nurse. And because I was more comfortable going to people that were at my same level, but that wasn't what's best for the patient. And then lastly, the hardest thing was learning that it's okay that I don't know everything. I feel like as a student, I was taught that you have to learn everything, and you have to be good at everything, but you're not going to learn everything on orientation, and that's okay. And the first time you're going to see something, it may be off orientation, and then going and learning the resources of who to talk to and who can teach you. Because in the NICU, we had a 4-month, 5-month orientation, which sounds really long, but you're not going to see everything on orientation. So it's learning the resources, knowing that it's okay that you don't know everything, because honestly, the day you do know everything, you probably shouldn't be working in ICU anymore or anywhere, because you have to always have that little bit of not fear, but that appreciation that what you're doing. But yeah, but once you learn it and once you realize that this is where you're meant to be, it's a fantastic career, and you want to mentor those new nurses because you know what it was like when that was you.
Thank you, Lindsay. Would anyone else like to chime in for this question? So the next question is, how do you build confidence as a provider? And this is really important because as nursing students, it's kind of hard for us to imagine what exactly kind of provider we would be like. So Zach, if you would like to answer this one.
Yes, I'll take that. So hello, everyone. So being new, whether you're a nurse, whether you're a nurse practitioner, whether you're in any field, it's tough because you don't know a lot, but you do know some things. And the most important part, Lindsay was saying, is finding those resources and finding those people that you feel comfortable speaking with, and asking those questions. When you're new, it's scary, but it's also exciting. It's a happy time, but it's also, you're going to face a lot of challenges. So again, finding those people around you that, you don't find threatening to ask questions to, because, you'll see there are some people that you might not want to ask certain questions to, or you might, and if that's something that you have, an issue with, find someone else who, you can pair up with as a resource, who, you do feel more comfortable asking those things to. And at the end of the day, remembering fundamentals is very important. Like remembering the basics. Someone once told me, they said, if you always remember patient safety, you're always going to get the question right, or you're always going to be able to treat the patient well. And that's key to remember that, if you have any question, remember, back to the basics of how to prevent falls, how to prevent, those sorts of fundamentals. And and you'll get there. It takes time. I would say as a new nurse, it took me probably almost a year, probably 9 or 10 months before I started to, by no means be an expert, but, became fluid with the protocols, the procedures, situations that might be a little difficult. So it takes time, and it's a process that everyone has to go through, and find those people that you can lean on, that you can ask questions to comfortably, and you'll go from there.
That was really great advice, Zach. Thank you.
No problem.
So because of the pandemic, we understand that as students, many things might have changed, such as their residency program, their orientation. So the question is, how has the experience for new grads changed since the pandemic? And Adam, since you were a recent new grad and you've talked to many students before, what have they said that they feel like is different from before? Oh, Adam, I think you're muted.
I am. Thanks for that. So particularly during the pandemic and the height of the pandemic, I mean, orientations were quick and they were brief, and nurses were kind of thrown into the fire very quickly because we needed people there. So it was a very hectic and chaotic experience. Fortunately, things have calmed down quite a bit since then, so many of you won't have to experience that. That being said, hospitals, and I can only speak for my hospital, but I imagine, and the programs I've seen, like critical care and ER, but from what I gather, people have learned that nurses can go on their own in a shorter amount of time because they did it under the worst circumstances, that being the pandemic. So, you know, what used to be a year-long ER residency is now 6 months here in my ER at NYU. And when I used to work in the ICU, we had to work in the ICU for at least a year before we started learning special therapies like pulmonary hypertension, continuous infusion pumps, or people on continuous renal replacement therapy, or extracorporeal membranous oxygenation, or, you know, so now those things are being sped up. And on the one hand, it's kind of really interesting to get that experience so quickly. And on the other hand, it's a great deal of responsibility to get so quickly. So, you know, a lot of what Zach was saying, find the people that you can lean on, make sure you're comfortable asking questions, be confident in the things that you know, and of course, the things you don't know. And no one expects a new graduate to get everything right. We expect you to make mistakes. We expect you to have questions. We expect you to be scared, not in a bad way, but just the responsibility of taking care of a human being is a lot. And you don't quite get that as a student. You don't really get it until you're dreading being on your own when your orientation is about to end. You know, a lot of times you're going to get feedback that you need to be faster. You don't need to be faster. You need to be faster about using your brain, but the mechanics, as Zach was saying, it comes with time. So your orientation is likely to be shorter, but the nurses that are there know that, and you find the nurses who are, you know, in tune with that, and they will be your mentors, and they will help shepherd you until the point at which you gain your confidence. So don't worry.
That was an amazing answer. And actually, when you were saying, when new grads are being told that they need to be faster, that actually just happened this past weekend when I was working. I heard a new grad ask a nurse for feedback, and the nurse was like, I really expect you to be faster. And then I thought, like, if you're faster with everything you're doing, I'm sure that the mistakes that are made are much higher. So when you say faster using your brain, that makes a lot more sense.
Yeah, and the nurse that was probably speaking to you meant faster physically, but it's just not a reasonable expectation. Mm-hmm. So I encourage all of you to remember that. You will get that feedback all the time, but unfortunately, not every preceptor is the most amazing, and that's okay too. You just have to realize that you shouldn't be fast. You should be safe. You have to be safe, and that's the most important thing.
I just actually want to chime in on something with this too. Also, from an experience when I first became a nurse years and years ago, is you're going to end up developing your own style also. Like, yes, you'll have your preceptors and you will have the people that are mentoring you and whatnot, but their style might not necessarily 100% mesh with how your style is going to end up being as a nurse. And you need to end up doing what's the most comfortable for you to get the job done safely in the most correct way in order for the patient to benefit from everything also, and the rest of the healthcare team that you end up working with. So yeah, and if you aren't a good worried, like everyone's saying, like a good scared, then I would be nervous as a new graduate if you weren't, if that makes sense too.
Yeah, exactly. I mean, you're gonna have you know, a lot of nerves, and that is okay, you know. And the processes of things take a while to learn. And I remember like hanging a piggyback antibiotic, the idea of, you know, the piggyback of antibiotic goes higher than the saline bag. You know, that took a while for me to pick up, and, you know, to undo the clamp so that antibiotic actually runs. Just processes like that take repetition. And then after a while, it becomes routine, and, you know, you learn, you know, that and how to, you know, go ahead with things. But it does take time, and that's just a process everyone has to go through.
This is all really, really great advice. Thank you. For our next question, it kind of has to do with like orientation and like residency programs. But say I'm someone who got accepted into a residency program and I'm currently going through it, and I realized that I don't like the work culture. Should I quit if I have another offer, or should I just quit in general? Because I am a new grad and I am just in the residency program. So is it better to just stop because I don't like the work culture that I currently am seeing around me? Julie, would you like to answer this one?
Yeah, I think, hi, I'm Julie. I work in labor and delivery at Tisch. I think you have to kind of think about what is it that is really bothering you about the work culture, because in the beginning it can be very difficult. And your experience might be only specific to certain people, like your preceptor. I would also look to see the people who have been there the longest, and are they happy? And do they enjoy what they do? And are they collaborative? And if you're not seeing that, then that is a question I would ask, like, well, where do I want to be when I'm 5 years in? Do I want to be like them, or do I want to be somewhere else? And I would probably say, as a hiring manager, I mean, I'm not a hiring manager now, but, you know, someone who leaves a job, it doesn't look great, whether you have a job or you don't have another job. But that being said, you know, you also don't want to invest that time if it's going to be wasted. And you're also wasting the unit's time. If you go through orientation and labor and delivery, we have a 4.5 to 5 month orientation. If you're going to leave it 1 year so you can transfer to another department, then that's doing a disservice to the unit and also to the organization that you work for. So it's a balance. There's no clear answer, but.
That's really amazing insight. Thank you, Julie. Our next question has to do with specialties and areas of nursing, and this is a very popular topic when we were gathering questions from the students. So the question is, how do you know what area of nursing you wanted to enter? Because in NYU, you only get about 6 weeks to 1 semester to be introduced to a specialty. So how did you know you want to be in the current specialty that you are in, and how did you get experience in it? Did you have to start with med-surg, or were you able to directly be in the specialty that you are now? And Marianne, since you're in pediatrics and neonatals, did you want to answer this one?
Yeah, absolutely. Thanks, Rosabelle. So I don't know if all of our admission essays still exist at NYU, but I wrote this really heartfelt essay about how I was going to be a pediatric hematology oncology nurse. And I'll tell you right now, those are the angels of this profession. And I am not a pediatric hematology oncology nurse, but I knew from the get-go that I was going to be in pediatrics. And after I passed my NCLEX, I sent my resume out to any pediatric listing available, and nobody would hire me, and nobody would hire me. And I finally reached out to my mentor, and I was able to get onto a pediatric med-surg unit. So I know a lot of people say, like, you should do med-surg if you don't know what you want to do, but I knew I wanted pediatrics. So I reached out, I got a job on med-surg. And, you know, to kind of piggyback off what Julie was saying, I worked there for 2 years before I transferred to the pediatric ICU, because I didn't know that I wanted to be an ICU nurse. There's no one in my family that's a nurse. So I didn't really know what a nurse was before I started, you know, volunteering and doing all that kind of stuff. So as far as specialties go, you might not know what you want, and that's okay, because there are a lot of specialties out there. I went to pediatric ICU, and I had planned to, end my career there. And then there was an opportunity to join the transport team about 3 years after I've been in the ICU for a while. And I was like, oh, I want that. I want to do that. I didn't know I wanted to do that. So you might not know what you want, and that's okay. But if you do know that you want something, there are residency programs a lot. Years ago, people told you to go to adult med surg, don't apply to specialty programs. Nowadays, it's a lot different. Now there are residency programs specifically for neonatal, specifically for pediatric ICU, specifically for ED. So if you know what you want, there's a job out there you can apply for. And if you don't know what you want, yeah, maybe you can go to adult med surg and you might find out what you want from there. So the great thing about nursing is there, and you can see in this panel, right? You can like sort of scroll through and see there's so many different types of nursing out there. So there's my answer.
That was really, really amazing advice.
I
So
can
the
also
topic
add
of
on to
specialty.
that.
Oh yes, you may.
Sorry. So when I graduated, I immediately wanted to go into psych, so much so that with the dual degree program, I had applied to the psychiatric mental health program. But unfortunately, when I graduated, I applied and passed the NCLEX. I applied to a lot of psych jobs, but they wanted 1 year experience. So I was not able to find one. So I started off on med surg. And this was a little bit before the pandemic because I graduated in 2019. So almost as soon as I started, I got thrown into the COVID ICU, and I never wanted to do ICU, but I did learn a lot of skills, which I think are invaluable now. And then being in that position, I thought it would be best to sort of learn more ICU skills, especially in the case of there being another pandemic. So I switched to the CTICU. So there's a lot of flexibility with that. And then after I got my 2 years nursing experience, pretty much 2 years sharp, I switched to psych because there were a lot more jobs available for nurses with experience in psych.
That was really, really good advice too, because I think a lot of students see themselves being in that position, especially if they don't know exactly what they want to do yet. So it is okay to have a few years and to build experience and then to transfer specialties, because that's most definitely possible in this profession. And speaking more about like changing specialties, Marianne, did you want to also add on to like how easy it was to change, or like did you have to wait for a spot to be open, or what was that process like changing from pediatric med surg to pediatric ICU, then to the transport team?
So I don't know if anyone else has had a different experience, but I actually went to my nurse manager and I was like nervous. I was shaking. I was like, oh, she's going to be so mad at me. And I said, this is something I'm really interested in. I've heard that they are starting a new fellowship in the ICU and I would really, really like to join. And my nurse manager, instead of, I imagined, the big cartoon yelling, I imagined that was what was going to happen. And she said, this is amazing. I'm so happy about this. This is going to be great for you. Let me email their nurse manager right now and we'll help you transition into that role. So, I had been on med surg for 2.5 years and was, not yelled at for asking to do something else. So in this capacity, this is possible, right, to transition. And then I was able to do a full fellowship for ICU, which was really great. So I don't know if anyone has had a different experience, but it was a great experience for me.
I had a question about internal transfers though, because you said the manager reached out to the other manager of the ICU program. Did you have to go through like the whole application, interview, recommendation process just as any other applicant, or are internal transfers more of like they put you like higher up on the list?
I had to interview. I actually worked 3 night shifts in a row and then went to my interview. And I think at one point I had like half a ponytail in the middle of my interview. And I was like, oh, great. I'm not going to get picked. This is going to be awesome. But I did have to interview and send in my was the word you used, my recommendations from other people. So I did have to go through the whole process through talent and everything like that. But I mean, it was nice because I was known, right? You get a little bit of oh, well, we know her, so this one's going to be easy to transfer through.
Thank you.
Mhm.
So the next question is for the accelerated students who are on the panel today. So it is really well known that as a traditional student, you get one summer off to do externships, to volunteer, to just get experience and find out what specialty you're interested in. However, for accelerated students, they don't have the summer off and they have to do their second or third sequence during that semester. So as an accelerated student, how are you able to find opportunities to add to your hospital experience on top of clinicals prior to graduation? And Adam, as an accelerated student, do you also want to take this question? And you're muted again.
I did it again. So there are two things to keep in mind here. One, if you're an accelerated student and you had work experience before becoming a nurse, most likely whatever experience you had is relevant to your nursing career. And it's super important that you realize that your skills are transferable. If you worked in customer service, that's important for nursing. If you were a teacher, that's important for nursing. If you were a waiter, that's important for nursing. Everything that you have done to this point is crucial to being a good nurse. And it's important that you know your worth and that you position your resume to tell that story. So you may not need additional experience. Your experience as a human who's lived in the world longer than your traditional school peers may be all that you need. However, if you still feel uncomfortable, the good news is there are opportunities for you. There are a lot of student nurse positions, both at NYU and Cornell, that will take you in your third sequence, and you will be able to work in the hospital alongside the nurses, and you'll sit with patients and you'll help keep them safe. A lot of times, if you tell the nurses that you're an eager student looking to get as much hands-on experience as possible, they might allow you to help them with other things. But mostly you're there to keep the patient safe and to observe, but this experience is as good as any. So I encourage you to look at those opportunities. Fidel Lim is a huge champion for you all, and he will help you secure these positions as best as he's able to. I don't know if there are other faculty at the moment who are as involved as he is in doing that. He was certainly the most involved when I was a student back in 2017. And I worked at Cornell. So I strongly recommend that you look into that. But I think the really important thing to understand and appreciate is that you may not need anything else. You have an abundance of experience, all of which you should look at it and reframe it as it relates to nursing, because I can assure you that anything you've done will be extremely useful in your new career.
That advice is it really resonated with me. And that program you're talking about, Dr. Lim, he still is cheerleading students with the connection that he has at Cornell for the one-on-one companionship program. So a lot of students always reach out to him for that. Fidel Lim, he's amazing. He gets so many students hired. But as a new grad, you go through something called the residency program, which is a part of your orientation process and your transition from being a student to a new grad. Sometimes it includes classroom hours, sometimes it's like shadowing a nurse, sometimes you're on the unit learning. So students wanted to hear what the kind of different residency programs that your hospital offers or that you kind of went through. Marianne, do you want to start talking about the Cohen's Hospital?
Yeah, absolutely. So I can really only speak to Cohen's as far as residency programs go. Not every job listing is connected to a residency program. So there's a neonatal residency program, there is a pediatric ED and pediatric ICU who start together and then they sort of veer off in the middle. And all of the residency programs in my hospital have what, like Rosabelle was saying, didactic classes at the beginning. It's about 12 weeks of didactic, and then it's 12 weeks of orientation. And then for the rest of the year, the first year that you're a nurse, you're basically resourced. There's a resource RN in all of the intensive care areas that will basically kind of be your helper, you know, like, or be there to sort of counsel you through maybe a difficult patient or a difficult process that you have to go through. There are other jobs though that you don't have a residency program for. I don't know if anyone else wants to speak to that, but that's how it is at my hospital.
I'll speak regarding NYU's residency program. I think it was great. They usually, what we do is, or what they do now is, you're part of a cohort of the same like new grads who are hired along just like the same, I think, month that you were in. And what they do is they get a bunch of nurse educators. You actually sit down for a little while to do some classroom learning, which is great because this time you're learning stuff, but you're getting paid to do it. You actually get to go on the floor for a little bit to orient with the staff nurses to do actual work. Then sometimes they actually have a moment where they set you up with you set yourself up with a shadow opportunity to a specialty that you would like to do. I think you spend a day, I think you have to reach out to one of the managers or the floor managers to like, set up that opportunity. And I think the main thing is you have to do a PICO project with some of your cohort members, basically saying this is one of the things we want to implement on the unit to make it better. And that's pretty much, I think we do that in nursing school. You do that again professionally and present it at the end of the year, and then you get a promotion.
Yeah, that was really, really great advice. And the PICO project, it does seem like it does always come up past graduation. Like we're not over with it just from the research class that we did in our first sequence. So it's good to know that. I had a question about the didactic lectures. You said there was like 12 weeks of it. How is that learning different than what we receive in school? Is it more specific to the hospital in terms of like guidelines, or is it like NCLEX review type of situation?
No, it'll be more specific to the unit that you're going to, right? So you'll have lectures for our PICU residency program, you'll have lectures from the intensivists that work there, cardio specific lectures, neuro specific lectures, and then a lot of them involve hands-on as well. So you'll do, you're priming meds, you're doing code calculations, you're doing all that sort of stuff at the same time. So it's very unit specific.
I'd also like to add that they also add in or tie in the annual competencies that RNs are supposed to do every year. So you kind of go through that initially with the residency program.
Thank you. For the next question, this has to do with a lot of questions that a lot of students wanted to know about. It is, please describe the timeline of how you got your first nursing job after graduation. How were you able to balance studying for the NCLEX, graduating, applying for jobs, and taking a break? And Tiffany, as the most recent new grad, would you like to take this one?
Yeah, sure. During my last month of the nursing program, I got hired as a medical assistant at a clinic, and they promised to hire me as a nurse when I passed my NCLEX. So they were very flexible with giving me time to study for that. But as soon as I graduated, I went to travel because, during school, you're very busy. So I traveled for about a month, and then I came back. They were also flexible with giving me time off, which is how I traveled so quickly after starting. So I came back and then I started studying for NCLEX, and I did a bunch of UWorld questions. They have a huge reservoir of questions, and I think I did all of them. So I would recommend that. Also, I did a few Kaplan questions. And during studying, I would try to give myself a limit as to how much I would study every day, just so I can fit in other things in my life. I should also add that I did start studying during school as they recommend, but not as much as I studied during the summer, to be completely transparent. So then I studied for about a month, pretty much almost every day. And then I took my NCLEX, and when I passed, I was offered the nurse as an I was offered the position as an RN at the clinic, but I turned that down because I actually got offered a residency program, which I thought was going to be more helpful for me as a new grad, especially because the residency program is a year long. So that helped me a lot. And it did take me a while to apply for jobs. And eventually, my first job I landed because I kept in touch with people who I graduated with, and they were able to connect me with their managers, which was super helpful.
That was a great description of your timeline. And as someone who is graduating in the next month, I would like to hear how other people did it because I'm trying to figure out my own timeline. And so are a lot of students on this panel as well.
Can I just say one thing? I really want to echo what Tiffany said. As someone who does a lot of hiring, take the time. When you start as a new nurse, you're unfortunately probably going to be one on the bottom of the list to get vacation time after that. So I felt like as a new grad, I wanted to start my job already. And I just couldn't wait to start it. But then I didn't get a good vacation for a year. But if I pushed off I started in July, it wouldn't have hurt me to start in August or September if I had that time to just really enjoy and relax. So take the time if you want to. Your job will be there when you're ready for it, because once you start working, you're working.
Thank you. That was also really, really great advice. The next question is, how flexible is it to get licensed in another state? Joe and Lindsay, I believe you guys have, and Edwin have licenses outside of New York. So if you can speak more about what that process is like, about holding dual state licenses or transferring licenses, that'd be great.
Yeah, I could start with this. I actually just now have New York State. I used to have Florida also. I did travel contracts in Florida. The process is pretty similar in each state. It just depends on what state you work in. And it also depends on if you're, I think, part of the compact states. I know New York and Florida were not part of the compact states, with meaning like there's a certain number of states within the United States that if you get a license in one of them, you can end up having and practice in all those states. When I got my license in Florida, the process took time. They do background checks. Florida did fingerprinting. You have to do lots of other things like applications, the fees and whatnot. It's not that it's not doable. It's just, it takes time. And especially if you're going into travel nursing, you have to think about that in between, like say your contracts or whatnot, in order to have enough time to get the different licenses in different states. Also, once you get your licenses in different states, you always have them and you can always keep them and just keep renewing them. Or like in my case, I chose to let my Florida one lapse because obviously I live in New York and work in New York now. I didn't need it anymore. But once you have it, unless something happens or whatnot, you just pay and keep going with it like you do with New York State or wherever state you're licensed in. I know you said, Edwin, you have a Jersey state license, right? Maybe if you want to speak on that.
Yeah, sure. I believe when I got my New York one, it was fairly straightforward and easy, just a lot of just filling out forms and fees. New Jersey was a little more difficult. I did have to go get fingerprinting done. There's a different like background check. They didn't, I think a lot of the states that are the nurses get paid the most are not part of that compact. I think California is not part of it. New York's not part of it. So if you are looking to look at working one of those states, you probably have to do it all separately. But New Jersey did accept my New York license as proof that I am licensed, and I don't have to show them another NCLEX or anything like that. So it was fairly straightforward. It just took a lot of time.
So I got a Connecticut state license and I kept my New York one. So I work in Connecticut Monday through Friday per se, and I work in New York on Saturday and Sunday. So I have them both, but I got my Connecticut one during the pandemic, and I definitely fell into the trap of the state of Connecticut, and I wanted the state of New York also may have done this, where if you had a license in another state, they automatically gave you a license in their state because they just needed nurses in the height of it. But my health system did not follow that. So I literally 3 days before my temp expired was going to lose my new job if I did not do the paperwork and pay the fee. It was minor, but I never thought that there was going to be that the state law would be different than my hospital, because you have to always, it's the smaller organization that you have to follow for. And now it's just, you have to, like Edwin was saying and Joe was saying, it's the little things you have to just keep track of. Like Connecticut, I have to renew every year. New York, I renew, what is it, every 3 years? 4 years, 2 years? I don't know, but it's not every year. So it's like just keeping track of what you have to do when, but it's easy enough to follow.
Yeah, and they send you notices in the mail and whatnot when you're up for renewal, and it's usually, I don't even know how many months in advance it is, but like, for example, oh gosh, I can't even remember which one I have to renew this year in the summer. It's either my NP or my RN one, and I got a notice in like January for like the summertime. So they give you plenty of a time in advance to renew it. But like I said, this is also when you already have it, and it's simply just going and filling out an application. The initial process, like Edwin was saying also, can be lengthy because of, depending on what the state wants. Like he said in Jersey with fingerprinting. I remember doing it in Florida, and I had to do like 2 sets of fingerprints at like 2 different times. And it was just some of the requirements are a little bit crazy versus other states. And you kind of wonder like, okay, which one is, which state is actually caring more or not caring more, I guess. I don't know. It's kind of funny actually, but you just have to allow yourself time in order to get the licenses.
Thank you. Just wrapping up on our last 2 questions. The first one is, how do you deal with an uncooperative or upset family member or patient? Marianne and Julie, if you would like to answer this one.
Yeah, so I'm going to speak about this from the pediatric side. It can be difficult and it can be very stressful. I always say that I am honored to be present for a family's worst day of their life. And a lot of times you just have to listen, right? A lot of times a situation can escalate and escalate and escalate. And really the one thing that they want is they just want to be heard, right? Especially in an ICU situation, these are their babies. And you have parents that are basically almost have to give up care of their child because we now are caring for their child. And that is a very fine line to walk, because you're almost taking away their responsibility of taking care of their own child. And most of the time, honestly, especially if I don't have a crashing child, I take the time to listen. And I'm pretty sure that you have to take a communications class and do like communication sim through your classes at NYU. That idea of silence, right? Like I just sit there and I'll hold someone's hand. I'm a touchy-feely person, right? And you have to gauge it, right? Some people are not. Some people do not like to be touched, right? So like a hand on a shoulder, a hand on a leg, and just listening, right? And that usually can de-escalate any situation. If you're getting into like higher situations that cannot be de-escalated from that, then usually you're calling security and you're asking for more assistance there. As far as unruly patients, I during COVID, I worked in the adult ICU, and I actually had a gentleman snap at me. He was like snapping at me. I was like, sir, this does not happen here. So I can't really speak to adults because that is a whole different situation. But for parents, a lot of times it's really just listening. And I feel like Julie, you probably can attest to this also.
Just, yeah, to really echo what Marianne said, whether it's a challenging situation with an outcome that is difficult, that just listening and the silence and being present, and because people can tell when you're present and when you're not present. And the other thing also is that sometimes in labor, people come in with a very specific idea of how their labor or their delivery is going to be. And there's something called a birth plan that people come up with. And the plan a lot of times goes off track. And so it's sort of validating what they wanted and listening to them and sort of repeating back, like, I understand this is what you want and how upsetting this would be. And obviously, like, yes, we would love for that to have happened, but this is not where we're at right now. But really just, again, listening and making sure that you're repeating back in their words what you're hearing from them goes a long way to de-escalate. And, you know, thankfully, we generally don't have a lot of really, for lack of a better term, volatile or nasty patients, but we do sometimes. And as a nurse, I just always tell myself this outburst that this person is going through, whether it's a patient or a family member, has nothing to do with me. It has everything to do with the fear, the pain, something else. And when I can sort of detach from that, I can then stay calm. Because it really is never about you. It's always about something else. And it may not be what's about something there in the room. It may be about something at home that you don't know. So, and that goes for all things in nursing. You know, it's generally never about you. It's about them.
If I could jump in there real quick, I work in the ER, and so we do get a lot of upset people all the time.
Do people snap at you, Adam?
Oh, they snap, but usually it's not at me. I'm usually actually sent in to go de-escalate the situation. We had a patient come in just the other day, very angry, was refusing, you know, routine things like an EKG at triage, and came back to my team and they said, Adam, you're taking this patient. What everyone already said, you know, Julie hit it right on the head, and so did Marianne. Listening to them is the most important thing you can do. But you also can offer them an apology, even if you're not the one responsible. Just let them know that you're sorry they had that experience. Let them validate their feelings. Active listening is the most important thing. Again, Julie and Marianne couldn't have said it any better. But offering them an apology for their experience, and then asking them what you can do to make it better, and then telling them your plan, keeping them informed about what to expect. In the ER, you don't have time to be with someone every minute. You have to let them know what to expect. Here's the plan. Here's what we're going to do. Here's when you can expect an update from me. If I don't come into you in this time, use the call bell. Give them what they need so that they are assured that you are taking good care of them, that it's okay if you didn't get back to them in a certain amount of time, that they recognize that you're also a human being. The more that you can instill in them that you are a human just like them, the better off you're going to be. So everything that Julie and Marianne said, plus if they're very upset, offer an apology, ask them what you can do to make it better, and then come up with a plan that works for the both of you to move forward.
Yeah, I definitely echo off all that too and agree with that, being that I've worked in many different places, ER, I'm in the ICU now and whatnot, is you have to try to remember is maybe this patient has already went through multiple people and has had different frustrations maybe with each person. So you might end up being on the tail end of this, and this is why you're getting the outburst. And there's been times where literally I've just sat and listened to them, not said a word, listen, and let them vent. I mean, it's good to vent sometimes, and we all know this. And once they vent, then I talk with them. And I've even, like Adam was saying, maybe they don't want to do an EKG, or maybe they don't want to do this. Sometimes I'll say, well, if we can try this, then maybe we'll talk about doing this other test or something in the next hour or so. Like, if you can try to work with them and they see that you're working with them, that helps a lot also. But listening by far is one of the best things. Just let them vent. I mean, you're not always going to get every patient that's going to be receptive to it, and they're just having a bad day, and nothing's going to change that. And then also too, what I find is at the point when you do receive them as being like a frustrated patient, say maybe they just haven't had everything explained to them in a way that they even understand. And if you can take the time to just sit and maybe reiterate things to them or explain it to them in a way that they understand or break it down to them in a more easy way, then you'd be surprised at how quickly they change and how quickly they'll be on your side.
Yeah, I'll add to that. So I think I agree with what everyone said. I mean, it's very important to to understand, you know, there's an idea, you know, like service recovery. It applies to nurses just like it applies to people that work customer service. You know, think about how you feel when something happens with a flight you're on. I mean, flying, you know, your flight gets canceled. You know, you want transparency. You want to know a plan. You want to know a timeline to that plan if it can be provided. You know, and yeah, and sort of, you know, working with the patient. I mean, patients are allowed to refuse things. It's their right. But making sure they are educated and informed on what refusing care can mean in the next hour, day, weeks. You know, if it's in that, you know, in that situation, and you know, you go from there. I mean, you know, I've had times where people, you know, have said, "Oh, this patient's, you know, can you go in there and you know, talk to this patient because you're good at that?" And I'll go in there, and the patient will be very pleasant and not irate. So you have to don't always hear from one nurse that a patient's a certain way and take that for face value, because patients can be different towards different people, and experiencing that yourself, you know, is valuable, because not all patients get along with NPs or nurses or someone that they're dealing with. So just changing the staff sometimes that go in there, like Adam was saying, can help.
And a small piggyback off of that, use translator phones. Please use them. Use them. They are your friend.
Thank you, everyone, for sharing your perspective. It was interesting to see everyone's different specialties come into play, but the core and the base of dealing with an upset or uncooperative patient is pretty much the same. And for the very last question for this panel is, how do you manage to not bring work home with you and carry the stress of patient care into your own life and your own relationships? And Edwin, I believe you have a family, so maybe you can talk about this.
Sure. So I think the biggest thing for staff nurses is that we're shift workers. So that means when our shift is done, that means the responsibility is passed on to the next nurse, the next crew who are there and going to take care of the patient. So, you know, you should be able to go home knowing that the patient will be taken care of. It's not like we close shop and we, you know, shut the doors and, you know, oh, if you're too late, you know, guys, nothing like that. So I think some of the big things I've seen some people do is they might dwell on like, oh, did I document that right after they get home, or did I do everything correctly during this like rapid response or, you know, critical event? And I think that will just sort itself out over time and experience. So I know a lot, even for myself, I would go home and be like, oh man, did I do everything correctly when the patient was deteriorating? Did I do the right things? And I think that those thoughts kind of dwelled with me in the beginning, but I think after time, you know, you just get better at, you know, what you're doing. So, so yeah, I'm usually pretty good at not bringing my the work home. Especially I have 2 young kids, and I can't be telling them what's going on at work. They would never. Anyway. And lastly, I usually reserve my work venting with my colleagues after hours, so that way you can get that sort of thing out. Oh, you know, I happened to work today. Like, my wife doesn't want to hear what I have to say from work, so it works out. And then everyone always, anytime you get dinner with your nurse colleagues, it always ends up being a venting session anyway. So, yeah.
And that's great. Thank you, all the panelists, so much for sharing your work and your experience with us. At this time, we will now set up breakout rooms. So as attendees, you're able to attend these different breakout rooms to talk more about what their experience is like and their time as a NYU alum. and you'll also be able to network. You're not committed to staying to one room. You can hop around, jump to different rooms, whatever you would like. So if you would want to talk about what it's like being a recent new grad and talk about the NCLEX and psych nursing, you can go to Tiffany's room. If you want to talk more about like the recruiting process, as a director, Lindsay has a lot of experience in that. I know Adam, he is an ER nurse. If you want to know about NYU's ER residency program, he has a lot of insight about that. And Edwin, he is also in the emergency department as an RN, so you can talk to him about that. Marianne, her specialty is in pediatrics, as you know. So if you're interested in pediatrics, please feel free to hop into her room. Joe, he is an NP, a very experienced family nurse practitioner. So if that's what you're interested in, please go network with him. And lastly, we have Zach and Julie. Zach, he is an NP. He's actually a new NP. So if you're interested in what it's like being a new NP in the orthopedic setting, or whether you're interested in labor delivery at NYU Tisch, Julie is a really great resource. So at this time, if Janet has set up the breakout rooms.
I'm going to go ahead and open up all the rooms. Our speakers will automatically go there. And for all of our guests, you'll have the opportunity to choose which room you go into. If for some reason you were not able to automatically get into a room, just stay in this main room and I will, you can come off mute and tell me which room you would like to go to, and I will automatically assign you to that place.
Rosabelle.
Yes. Did you have a
Yes. Who was the one who's the recruiter, you said?
The recruiter, Lindsay, she is a director of nursing as a NICU, but she has a lot of experience in recruiting, reading resumes. So if you want to talk to her more about recruiting, you can join her room. And I remember you also had a question about the NCLEX, so Tiffany can definitely answer questions about that too. You can hop around, you don't have to stay. Katie, do you have a question?
Okay. Okay, thank you.
Sorry, when I go to click breakout rooms, it's just like a white screen and I can't go in.
Oh yeah, that happens. Janet,
yeah, which one, who was that just said you needed help?
Katie, hi.
Oh,
I
hi, Katie.
was looking to get into Marianne's group.
Sure, I will send you right now.
Great, thank you.
And everyone else who's left here. Amma, are you there?
There's a couple more.
Yes,
people.
I am. I'm trying to join something. I was quite confused because I thought that we will be told to join or automatically we get into the breakout rooms. But I realized that I have to click on it. So I'm doing
yeah. So you can choose, or we can place you. We can place.
Okay. Thank you.
You're welcome. And
Hi.
Sonia, hello.
Hey. So I just want to make sure Adam is the ortho NP.
Ortho NP was Zach.
Huh?
Zach. He's the orthopedic NP.
Oh, let me see.
You see Zach on he's the second.
Oh, I see. Thank you.
You're welcome.
Okay. And for our captioner, we are not going to do captioning in the breakout room, so we can end the captioning at this point, and you'll be finished a little bit earlier than you thought. So thank you again for being here, and thank you for your patience in getting everything going at the very beginning. Rosabelle, do you want to go into a room?
Oh yeah, I wanted to see which one to join too. I believe Joe and Edwin don't have people in their rooms. Maybe you can spread them out in like a room that is related to what they do. Like, I guess, you know what I mean? So that they're like not by themselves.
I know, I don't want to like move them. I don't want to move them though, because then I'm afraid like somebody will try to go in there and then nobody's there. But this is what happened last time. It was like, I remember like Adam came back into this room and was like, I'm just in there by myself. And then all of a sudden I was watching it. I was like, you better get back in there because people are coming in there now. So it just, I don't know. Yeah, you should go in there and talk to one of them. Joe's really good. If you're interested in ICU at all, he can tell you like everything about ICU. He's really good. And Edwin, of course, works at Langone, so he has a lot of experience just with that hospital system in general.
Okay.
And Joe's at Mount Sinai too. So if you're interested in Mount Sinai, he
Yeah.
can tell you all about that system.
Okay. I think I'm actually going to join Marianne's because I was interested in the pediatric ICU fellowship.
She's amazing too.
Yeah.
I love Marianne. She's like a rock star for sure. So definitely go into Marianne's and
Thank you.
Sit at her feet because she's got a lot of great things to share. And I'll be here. So if you need to come back, I'll be here. I'm just monitoring if people need help moving around the rooms.
And maybe you can make an announcement because I think since you're the host, you can announce that like
do you want me to send a message in like 10 minutes and say, feel free to change rooms or something like that?
Around, or you can say like,
okay,
when to expect to end, because I don't know if people know that this is ending at 8.
I will definitely, I'll figure out something to say like, we're 10 minutes in, feel free to switch or something like that. So I'll figure it out and then I'll send a message to everybody.
Okay. And yeah, Joe has someone in his room.
Yay.
I'm gonna take a bathroom break and then I'm gonna change.
Okay. Okay.
Yep, just trying to transition to another breakout.
Hi there. Sure. Do you know which room you want to go to?
Yes, I am trying to go with Joseph.
Which one?
Joseph, the travel nurse. I think I see it.
Oh, do you have it?
Yeah. Thank you, Janet.
Okay. Great. You're welcome. Enjoy. Joe's awesome.
All right. I press join.
Oh, Janet, Katie in
Yes.
Marianne's room, she wanted to switch to, I believe, Adam's room or Edwin's room. So maybe you can bring her back in here and then she can tell you which one she wants to switch to.
Wait, her name is Katie?
Yeah.
Oh no, okay, so she's in Edwin's room, right?
Let me see where she.
Katie Sanders.
Oh, I guess she figured it out. She was stuck for a while, so.
Okay, so she's where she wants to be in Edwin's room, right?
Okay.
Okay, perfect.
Yeah.
Hi there. Hi there.
I just came back to join another breakout room.
Sure.
Yeah.
Which one would you like to go to?
Tiffany.
Tiffany, sure.
Okay, thank you.
Here you go. Hi there. Do you need help going into another room?
No, I'm transitioning, so
Okay.
I'm into another room. Thank you.
Great, great.
Okay, I need the family nurse practitioner. Who was that? Is it Joe?
Yes. Do you want me to put you in there? Oh wait, I can't find you. Where are you?
Sorry, is it Joe?
Yes, Joe is the. All right, you want me to put you in there now?
Yeah, I could join. If I could join, I can join.
Sure, I'm gonna send you right now. Here you go. Hi there. Let me know if you need help getting into another room.
Thank you for making it quick because they are busy with other people, so I don't know. I just don't know because I want somewhere that I could interact.
You know what? There's 2 rooms that don't have anybody in them.
Wait,
Zach,
which
who
rooms?
is,
Yeah.
yeah,
Can
he's an
you
orthopedic NP.
yeah,
Yep.
do that for me. Do that for me, Zach.
He's great. He's great.
Thank you.
Hang
Yeah.
on. Ooh. Hi there.
Hi. I finished asking my questions. I didn't know if I should come back to the main room.
Yeah, you're welcome to stay here. I'm actually about to close all the rooms. I'm going to send that message right now. So everybody be back in here in about 1 minute, and then we'll just do very short remarks, and that'll be that.
Is being recorded.
Janet, is everyone back here?
Recording in progress.
I think there's still some people coming back.
Okay, we'll wait for everyone to come back and then I'll do the closing.
Yeah, everybody's still filtering back in.
Okay, there. I see a lot more people now. Okay, perfect. So thank you everyone so much for coming tonight. I really want to thank on behalf of the Myers Recent Alumni Council and also for me on behalf of UNSO for joining our alumni and the panelists tonight. I hope you all had really great conversations within your breakout rooms. And if you needed to exchange contact information or didn't get the chance to, you can always reach out to me or Janet and we can help get the right contact information to you, because that's the point of this event. It's for networking, and we really hope that you can network beyond just this event and, you know, exchange emails.
Yeah,
whatever.
Can I actually say something about that? The breakout room that I was just in, the couple of students that I was in there with, Janet, they were, you know how we had set up the office hours thing for alumni?
Yes.
They actually didn't either maybe just didn't see the emails or whatnot, but they were unaware that they could do that with us.
Okay.
Like me and Adam, for example, and I know Marianne was part of that also. Because like I gave them my contact info in order to, like, you know, email me or speak to me, and I had explained to them that we had set that up and we had office hours for students if they wanted to talk to us specifically. So I don't know if those emails can be sent back out or
I
where
can
they can find
definitely.
that.
Yep, I can forward that to definitely to everyone that came tonight. And then I can send another email to the entire student body as well.
But yep, please, when you do get the email, take a look at that, because you will able to sign up one-on-one to speak with the alumni here tonight, more about their experiences, just to continue networking. If you want them to be your mentor, that is the perfect opportunity. So we really appreciate everyone's time for being here and for sharing your experiences about transitioning into the nursing profession. I can say on behalf of all the students that your career path has really been such an inspiration to all of us. And for everyone here today, I encourage everyone to follow NYU Myers on Facebook and Instagram. The Alumni Association posts a lot of information about upcoming events and special announcements that you will not want to miss. So without further ado, thank you so much. And I look forward to seeing you all at your next UNSO event. And thank you so much, Janet, for hosting this. It was amazing.
You're welcome.
Thank you.